I think involving patients in the decision-making process is critical. I think knowledge is power, and a lot of folks come to see me for a second opinion unaware that they were actually candidates for other types of therapy. I think all patients have multiple treatment options, although not all of them might be viable for them. But I think it's up to us as sort of the healthcare practitioners and experts in the field to avail patients or make them aware of what they're candidates for, and then discuss with them in particular my biases for one therapy over another, as well as why I think they may or may not be a good candidate for the various options that we listed. But it's not uncommon to see patients who actually did not know they were candidates for other types of therapy until we saw them here at Michigan. I tend to tell my patients, our patients, that we treat patients, not diseases. We don't fight cancer, we help patients. And I think reframing the argument or our interaction in that way also helps them adjust to the circumstances they're in, as well as sort of aligns us on the same team, to be on the same team. Again, that we're not fighting against cancer, we're fighting for the patient. And again, we don't treat diseases, we treat patients, because the distinction might be subtle, but their approach to a particular problem could be largely governed by our approach to that way. I mean, for example, a patient who comes in with a disease X, a certain kind of cancer X, well, we might treat it in one way in one patient, but a different patient who has the exact same disease, we might treat it in a different way, based upon their age, their other illnesses, their expectations, their prior medical history, and things like this. So it's not one size fits all.